Thank you, moderator. We appreciate that. I just want to make sure, can you hear me?
Yes, ma'am, I can.
I had some trouble with my computer. Good morning, everyone. Welcome to the Board of Vocational Nursing and Psychiatric Technicians. My name is Dr. Carol Mountain. I'm the board president. I would like to call this meeting to order at 9:01 a.m. Housekeeping information on.
Okay, Carol?
Yes.
I have to interrupt, Carol, so you're cutting in and out.
Let me try something else.
Okay.
Is that better?
Can you give it one more try?
Okay. First, some housekeeping information on how this meeting is being held via WebEx on Friday, August 20, 2021. I ask the board members and staff to mute their microphones to eliminate background noise. If they're ready to speak, they can unmute. WebEx has a feature to virtually raise your hand, and I ask board members to use this agenda item if they would like to comment or have questions. Need a motion? I will call for a motion, and any board member can raise their hand, identify themselves, and make a.
Carol, I have to pause you for a minute. We just heard from the webcasting person, and he's unable to pick up your voice. Can you try moving your microphone around just a little bit? Maybe it's a bad connection.
Okay. Can you ask him if this is better? I apologize. I'm right in front of the microphone.
It's better right now.
Excellent. All right. Should I start over about the housekeeping information?
Yes, please.
All right. First, some housekeeping information on how this meeting will be conducted. This meeting is being held via WebEx on Friday, August 20, 2021. I ask the board members and staff to mute their microphones to eliminate background noise. And when they are ready to speak, they can unmute. WebEx has a feature to virtually raise your hand, and I ask board members to use this function for each agenda item if they would like to comment or have questions. If we need a motion, I will call for a motion, and any board member can raise their hand, identify themselves, and make a motion. If you are seconding a motion, please raise your hand, unmute, identify yourself, and second the motion. I will take a roll call vote for each motion. Again, please identify yourself by name each time so our audience knows who is speaking. We will take public comment on each agenda item. If you wish to provide public comment, click on the Q&A button near the bottom center of your WebEx session. This brings up the Q&A chat box. To request time to speak, make sure the Ask menu is set to all panelists and type, I would like to make a public comment. Attendee lines will be unmuted in the order the requests are received, and you will be allowed to present public comment. Please note.
Carol, this is the moderator again. Carol, we're still having problems with your microphone.
What? I'm not sure what I
is
can
not
do.
able to pick up your voice.
I'm speaking right into the microphone.
That's perfect right there. So
Okay.
I'm not sure if there's a bad connection wherever you're at, or the microphone, or you're moving away from the microphone, but right now it sounds really good.
Okay. To request time to speak, make sure the Ask menu is set to all panelists and type, I would like to make a public comment. Attendee lines will be unmuted in the order the requests are received, and you will be allowed to present public comment. Please note, your line will be muted at the end of the allotted public comment duration, which is 3 minutes. You'll be notified when you have 10 seconds remaining. Your name is not necessary, but please indicate how you would like us to identify you. For the sake of efficiency, the executive officer will respond directly to public comment or defer to the appropriate staff person or counsel. For questions directed to the board members, I will either answer the question or direct it to the board members. I will now do an alphabetical roll call to establish quorum. I will ask each board member to respond here after I say their names. Taisha Brown. Ms. Brown? Moderator, is Ms. Brown here?
No, ma'am, I don't see her in the audience.
Thank you. Alita Carpenter is absent and excused. John Durking.
Good morning. Here.
Thank you. Abraham Hill.
Here.
Ken Maxey.
Good morning.
Thank you. Tara Rooks.
Good morning, this is Tara.
Thank you. Cheryl Turner.
Here.
I believe that we have established a quorum with those that are present. Ms. Yamaguchi, would you please introduce yourself and your staff?
Thank you, Madam Chair. Good morning, everybody. Elaine Yamaguchi, Executive Officer. With us today from the BVNPT staff, our AEO, Vicki Lyman, our Enforcement Chief, Antoinette Wood, our Personnel Specialist, Maggie Archibald, our Legend Regs Specialist, Doris Pierce, our Licensing Manager, Shelley Brown, and our Budget Analyst / meeting host, Vicki Saavedra. Of course, we also have Team Education, our SNEC, Marie Cordero, Cindy Fairchild, Faye Silverman, Charlene De La Rosa, Beth DeYoung, Judith McLeod, Jessica Gomez, and Geraldine Marcino. Madam Chair?
Thank you so much. Legal counsel, please introduce yourselves.
Good morning, this is Sheila Tatayan, Regulatory Counsel. I think we're waiting for Mr. Swenson.
Yes, that's correct, Madam Chair. Mr. Swenson's having some connection issues. He'll be in as soon as he can.
I understand. All right, let's move on to item 3, approval of the minutes. We have 2 sets of minutes to approve. Minutes for May 21, 2021. Can I have a motion to approve and a second?
Earl Turner moves to approve the May 21st, 2021 minutes.
Thank you.
Tara Rook, second.
Thank you. Any discussion or questions? Any public comment?
There are none at this time.
Thank you. I will do a roll call and establish who's in favor, opposed, or abstained. Brown? She's not here, sorry. Mr. Dirk?
Yes.
Thank you. Mr. Hill?
Yes.
Yes.
Ms. Rooks?
Oh, yes, I can hear you. I didn't hear the question though. I'm sorry. It's bad
Roll call
connection.
vote.
Yes.
Doing a roll call vote for the minutes.
Yes.
Thank you.
Yes. Yes. Yes.
Ms. Turner?
Yes.
Thank you. It's been moved and seconded. Okay, minutes for June 17, 2021. I have a motion and a second.
Cheryl Turner moves to approve the minutes for June 17, 2021.
Thank you.
Abraham, I'd like to second that.
Thank you. Do we have any discussion or questions?
I see none from the public.
Thank you, and none from the board as well. We'll establish who's in favor, opposed, or abstain.
Dr. Mountain, your microphone is cutting out again.
Mr. Durkin, I haven't moved not an iota.
There you go. Now I can hear you.
Mr. Durkin,
Yes.
Mr. Hill,
Yes.
Mr. Maxey,
Yes.
Ms. Rooks,
Yes.
Ms. Turner,
Yes.
and I am also a yes. The motion is approved by unanimous vote.
This is the moderator. Can we have a few minutes, Miss Dr. Mountain? We're trying to get legal counsel Ken Swenson on.
Absolutely, let us know when you're ready.
I will. Thank you. This is the moderator. We can proceed per Mr. Swenson. He's still trying to get in.
Did you say we should go ahead and proceed?
Yes, ma'am.
Okay. All right, I believe that we are ready to move on to item 4, fiscal budgets. And that will be an update from the DCA budget staff.
This is the moderator. I'm switching documents, so there's going to be a 30-second delay. DCA budgets, you're up.
Thank you, Vicki. Good morning. My name is Karen Munoz. I'm the budget manager over at DCA Budget's office. I will be presenting the first set of fund conditions statement that you see right now. This is just a quick update on the fund conditions since the last time we spoke. And as of now, I just want to go over that. What you see on the screen, it states current year is 2020-21. That is because we are going to, the numbers that we are presenting are based on fiscal month 11 or updated actuals through the year of 2021. So we do have a budget act of 21-22, and I know that we are currently in the fiscal year of 21-22, so I don't want that to confuse you when you're looking at the titles above. As you see in the current year for 2021, we have close to a 1% reversion in expenditures, and we have brought in, the board has brought in close to $18 million in revenue that we are tracking. We are very close to closing out the entire fiscal year of 2021. And so these projections are very close to what they're what we are expecting to bring in for the remainder of the fiscal year, I'll just say. So with that, it does show that the board is showing a reversion of 2 months, 2.8 months, or a months in reserve of 2.8 months. That will move up to our 21-22 budget of a beginning balance, $4.7 million, with an estimated revenue increase, or estimated revenue, excuse me, of 17.8, close to $18 million again in 21-22. With that, the board is expecting to expend upwards to $2 million or $20 million. That's including our direct hits to the fund, as well as we're also showing an estimated AG augmentation ongoing, just on the current trends of our AG costs. So we are projecting that increase. We're also projecting a 4.55% increase to all of our salaries. All state employees received GSI of 2.0 and 2.5 with a 0.05 increase. I might have went over this in our last meeting, so forgive me if I'm repeating myself, but they are receiving a 4.55 increase in their general salary. So that is also projected in a separate line item because it has not been included in the actual board's projections or their appropriation in the above line. So you'll see that in the first page under the 1111 projected expenditures. So that's their 17.8 for 21-22 is their budget. And then the 430,000 for the AG ongoing, as well as 535,000 increase for their salary increase. The fund is declining. There is some plans that the board is having to resolve this issue, and I will let that be discussed in the further in the slides below. But for now, this is where the board's state of fund is. I'd be happy to address any questions you have for the current year or the budget year projected expenditures and revenue. If you want to discuss anything ongoing, that will be addressed in the next presentation from our regulations analyst, Matt, but I can address anything current year and budget year right now. If there's any questions?
This is the moderator. I don't see any public comments either.
Okay, thank you, Vicki. If you want to move on to the next couple slides, Matt can take over discussing the projected fund conditions.
Thank you, Karen. This is Matt Nissimini. I'm with the Budget Office. You might remember me. I spoke in front of this board last November and last August talking about regulatory fees and trying to map out a path forward. The important thing to note in fund conditions that Ms. Munoz just went over is that we'll be going insolvent next fiscal year, second half of next fiscal year is what we think. So that's probably about 20 months, 18 to 22 months. We think you're going to go insolvent, and we can't let you do that. So Department of Finance will not let you go insolvent, and DCA, we're going to work with you not to insolvent.
This is the moderator. Matt, we're having a little bit of technical difficulties with your microphone.
Can you hear me now?
Yes, sir, that's better.
Okay. So we can't let you go insolvent. So the board, this is on the natural, we need to do something. We would like to get your regulatory fee increase effective on or about 1/1/23. So in about 12 to 14 months. Because the normal regulatory process takes 18 to 24 months, we're under a reduced time frame. So I just want to stress the urgency to get going. This fund condition statement that we're looking at here is similar to the one that Karen just went over, except we've updated the 2021 column with FM12 projections. So this is a month better of projections on that first column. And then you also see some purple lines and some sort of brownish lines. So the purple lines are fee increases, which would be effective 1/1/23, and we have the impact from AB 1536 effective 1/1/22. So let's discuss the base part, the effective school fees. So the AB 1536 was just amended recently on August 16th, and it provides for a fee schedule for the board to see continuing approval fees as well as initial application and final approval fees. If we look at the CY, the 2021-22 column, we see down below there's $375,000, and there's no new school approval fee. So let me explain that. The board has approximately 150 existing schools, approved schools, and if they all 150 would pay $5,000, that's $750,000. However, since we are only going to be collecting half year revenue, that $375,000 is half of that. The board indicates that probably won't start taking programs off the wait list and collecting the initial $5,000 application fee until the budget year, until 22-23. And so that is that $250,000 right in the middle there. And so what that comprises is the board is anticipating taking 20 schools off the wait list, and of those 20, based upon the timelines required of AB 21, of AB 1536, that of those 20, they will approve 10 of those schools in the 22-23 fiscal year. So the 20 schools off the wait list, they have to pay $5,000 initial application fee. That's $100,000, and then the 10, on final approval, have to pay an additional $15,000. So 15 times 10 is $150,000 plus the other $100,000. And then below we've got the $750,000. And then as we move out to the right, keep the $250,000 flat, assuming that 20 schools are taken off the wait list and assuming that 10 schools are approved each year. And then the continuing approval fee will grow as more schools are approved. So that's why it goes up $50,000. It goes from $750 to $800 to $850, and that's assuming that those 10 schools that were approved in the previous year are now paying their $5,000 annual fee. Are there any questions with that component of this analysis? I want to make sure you guys are real clear on what the current revenue would look like based on the current version. Okay, very good. This, okay, so, this is a different, okay, so this, and now if we look at the purple, so the purple is if we are to increase the current level, the current fees that the board has, statutory cap. So, and this would be effective 1/1/24. So it would be half year revenue in the 23-24 year, and then it would be full year revenue after that. So that's why if we see delinquent fees, that first purple line, the 23-24 column, $45,000, because we're only collecting year worth of revenue. And if you look at the purple numbers below that, the 2137 and the 124 and the 823, those represent half year revenue. And then if you go out to the right, delinquent fees, it's 90. That would represent the full year. We're going to start collecting 1/1/24. Now, if we could just scroll down a bit, we'll see that it's similar to what Ms. Munoz just went over. In the green line, estimated AG augmentation of $430,000. The board, that's the level that the board requested last year. Prior year to that, the board actually requested more, $645,000, but we're going to go with 430 because that's the most recent data. And that augmentation is required when the board is up against its appropriation limit and still has additional cases that it wants to either send to the AG or currently at the Attorney General, and those costs need to be paid. So we can request a current year augmentation. So that's what that 430,000 is. Below that is the GSI, so we have that factored in, and that's why it's in white because it's a hard number. And then we've got another beige area, AB 1536, estimated resources required. So the board is indicating that it's going to need 2 additional NECs and 1 associate government program analyst to help support and to meet the time frames required of AB 1536. And so the cost for that would be $671,000 per budget year. It goes down a bit in the budget year +1, and that's because what we call a standard complement. Those 3 staff, they need a computer, equipment, a cubicle, etc. So it's just standard operating equipment that we would provide those 3 staff, but they only need it once. That's why it goes down in the second year, so 635, but then it goes incrementally up again based on a 3% growth factor, and that would be for employee compensation and retirement costs. As we look down further, we see some red numbers, the minus 0.1 and the minus 0.3. So this is indicating that even if we start bringing in the new revenues as projected by the board related to AB 1536, and we were to initiate the fees effective 1/1/24, we're still going to go insolvent in the 22-23 year. And so again, we can't do that. It's 139,000 negative. The board could likely manage that amount. However, we don't know that for sure because the 430 for the AG augment up above is an estimate. And so to the extent the board needs additional money, more than 430,000, that could exacerbate that 139,000. That would make it worse. So do we have any questions there? If not, we can go down to the last slide.
It's just hard to hear you a little bit.
Okay, can you hear me now?
Yes.
I'm right up against the mic. I know. Thank you. So this model here is having the fees increase to the statutory cap effective 1/1/23, so in about 16 months. And we really would stress the urgency to abide by this time frame. And if we do this, the numbers are the same. The incremental adjustments are the same, but we moved them up a year. If we scroll to the bottom, we see the months in reserve, 1.5 in the 22-23 year. So this is the key to maintaining solvency for the board. We've got 1.5 months in reserve, and then as we move to the right, we see it growing. So a prudent reserve is between 3 and 6 months. So and a prudent reserve grows. So we would advocate and we would strongly recommend that the board pursue the fee increase to be effective 1/1/23 to avoid insolvency. Are there any questions?
I see no questions at this time.
Okay. I wanted to just address one question that Ms. Turner had the last time I attended, or maybe it was in the spring. I was watching some old board meetings, and she was curious about cost recovery. And that line item is in the other regulatory fees. So if we look at the PY column, that first column of numbers, the 2021 year, and if we go down to that third number, 415,000, so that is where the cost recovery is included. And in the 2021 fiscal year, the board received about $87,000 cost recovery. So that 87,000 is included in that 415,000. I want to make sure I addressed her question.
Well, thank you so much for that information. Glad to see it's there. Appreciate it.
Ms. Turner, your microphone is coming in very faint. Can you please speak up?
I said, thank you very much for that information. I appreciate it. I'm glad to know it's there and we can identify it.
Thank you, Ms. Turner.
Okay.
And thank you for that excellent presentation. I think that we are ready to move on to the Education Division report.
This is the moderator. I will switch back to the agenda. One moment, a 30-second delay.
Thank you so much. Ms. Cordero, would you provide the Education Division report?
Yes, hi, good morning, everyone. This is Marie Cordero. Board members, you have my report in your packet. I'd like to highlight 4 things for everyone. I just wanted to give an update on the nursing education consultants and their program visits. They are back making visits now, and they are scheduled to complete 50 plus visits by the end of the year, mostly related to programs continued approval process. So that's good. So programs, you might be seeing your NECs very soon. Some of issues and challenges during the pandemic that programs continue to experience residual challenges of COVID. Many of our programs have returned to clinical sites, either partially or fully, while others express concerns about the lack of clinical sites to provide hands-on learning for students. And the NECs are, of course, constantly in communication with the program directors to assist them the best way to meet the students' educational needs. Staff update, very sad to report that retired annuitants Ann Schumann and Sue Ellen Clayworth fully retired from state service on June 30th of this year. We'd like to thank them for their many years of service to the BVNPT and wish them well in their second retirement from state service. Excuse me. The last thing is that we have the Fall Directors Forum is scheduled for October 12th and 13th via WebEx. Our format has changed a bit, and I'm very excited about it because in addition to the general assembly that we always do, we are conducting several breakout sessions. And why this is exciting to me, because the breakout sessions are all topics that were provided or suggested to us from the previous directors' forums. So I feel that we are really taking into consideration what the program directors want to hear and the topics that they're interested in. So each program director will be able to go to several breakout sessions and hear the topics that they are interested in. So that's very exciting. And that's the end of my report. Unless you have any questions, I'll be happy to take them now.
Thank you. The review and approval of the EO program decision. The report is in your packets and the programs and recommendations are on the agenda itself. Can I have a motion to approve and a second?
So moved. This is Kenneth Maxey.
Thank you. Do we have a second?
John Deerking will second.
Thank you. Any discussion or questions? Any public comment?
There are no hands raised in the public at this time.
Thank you. I will do a roll call and establish who's in favor, opposed, or abstains. Mr. Durking,
Yes.
Mr. Hill,
Yes.
Kenneth Maxey, yes.
Ms. Rook,
Yes.
and Ms. Turner.
Yes.
And I am also a yes. It's moved unanimously. Please raise your hand if you have any other questions or comments on anything on the Education Division report.
Cheryl Turner. I wanted to mention, I want to thank the retired people for their service to the board.
Thank you so much for bringing that up, Ms. Turner. I agree. They have contributed so much, and absolutely am thankful to both of them. Any public comment?
There are no hands raised in the public.
Thank you so much. We will move on to item 5B, the Education Committee report. I will provide this report. The committee met on Monday, July 19, 2021, and the minutes are in the packet. At the meeting, the committee reviewed the recommendations from the NECs regarding post-COVID teaching modalities, which were presented and discussed at the April 2021 Education and Practice Committee, and then at the full board meeting in May of 2021. The recommendations are attached to the meeting minutes. The motion from the committee is that the full board adopt these recommendations. This motion does not require a second. Any discussion or questions from the board? Seeing none, any public comment?
There are no hands raised in the public.
Thank you. I will do a roll call and establish who is in favor, opposed, or abstains. Mr. Durking,
Yes.
Mr. Hill,
Yes.
Mr. Maxey,
Yes.
Ms. Rooks, Ms. Rooks,
Can you hear me?
yes.
Oh, yes. I'm
Thank
sorry.
you.
Uh-huh.
No worries.
Thank
Ms.
you.
Turner,
Yes.
I'm also a yes. It is passed unanimously. We will now move on to program reports from the NECs. Please note, for the following programs, these are not NEC decisions. Rather, the recommendations presented at the Executive Officer Review, the Education and Practice Committee, and/or the full board for action. The reports are posted on the website and recommendations may be updated prior to the open public meeting. Item 5C, reconsideration of provisional approval. First school is University of Antelope Valley Vocational Nursing Program, Ms. De La Rosa, Nursing Education Consultant. Can I have a motion to approve and a second? Is there a motion to approve?
This is Abraham. I'd like to make the motion and approve the NEC's recommendations.
Thank you so much. Do we have a second? Oh, Ms. Turner, you have your hand raised. I'm sorry, I didn't see it. Do we have a second?
I'll second.
John Dearking, second.
Thank you so much. Any discussion or questions? Any public comment?
This is the moderator, the director, LV. Chata's in the audience. I will unmute her microphone. Alvy, your microphone is unmuted.
Continue our program. We will continue to work on those areas for improvement that had been identified. And I would like to thank our consultant, Charlene De La Rosa, for being so available for any of my consultations. Thank you.
Thank you. I will do a roll call and establish who's in favor, opposed, or abstains. Mr. Durking,
Yes.
Mr. Hill,
Yes.
Mr. Maxey,
Yes.
Ms. Rooks,
Yes.
and Ms. Turner.
Yes.
And I am also a yes. That is passed unanimously. Item 5D, request to admit students. This first one is Premier Career College Vocational Nursing Program. Dr. Fairchild is the nursing education consultant. Can I have a motion to approve and a second?
So moved. This is Kenneth Maxey.
Thank you. Is there a second?
Carol Turner seconds.
Thank you so much. Any discussion or questions from the board? Seeing none, any public comment?
The director is in the audience. I will unmute his microphone now.
Thank you.
Bernie, your microphone is unmuted. You may speak if you'd like to.
All right. Good morning, everybody. My name is Mr. Bernie Malabanan, and I'm the Director of Nursing for Premier Career College. I agree with the recommendation of Dr. Fairchild, and I would like to express our deepest gratitude to her guidance and assistance with the approval of this request.
Thank you so much. I will do a roll call and establish who's in favor, opposed, or abstains. Mr. Durking?
Yes.
Thank you. Mr. Hill?
Yes.
Mr. Maxey?
Yes.
Ms. Rooks?
Yes.
Ms. Turner?
Yes.
I am also a yes. That is moved unanimously. We will now move on to Southeast Career College Vocational Nursing Program. Ms. De La Rosa, Nursing Education Consultant. Can I have a motion to approve and a second?
Carol Turner moves. We accept the report and adopt the recommendations of the NEC.
Thank you. We have a second?
Abraham Hill, I'd like to second.
Thank you. Any discussion or questions from the board? Seeing none, any public comment?
I do not see the director, Edna Domingo, in the audience, nor do I see any hands raised.
Thank you so much. I will do a roll call and establish who is in favor, opposed, or abstains. Mr. Durking?
Yes.
Mr. Hill?
Yes.
Mr. Maxey?
Yes.
Ms. Rooks?
Yes.
Ms. Turner?
Yes.
And I am also a yes. That is moved unanimously. We will now move on to 5E, consideration of provisional approval. The first one is Northwest College Riverside Vocational Nursing Program, Dr. McLeod, Nursing Education Consultant. Can we have a motion to approve and a second?
This is Abraham Hill. I'd like to make the motion to approve the NEC's recommendation.
Thank you. Is there a second?
Tara Rooks, I second.
Thank you. Any discussion or questions? Seeing none, any public comment?
I see the director, Catherine Silkey. I will unmute her microphone now. Director Silkey, your microphone is unmuted.
Hi, this is Dr. Catherine Silkey. I'm the director of this program at Northwest College Riverside. And we recently had a site visit actually by Dr. McLeod, and we really appreciate her support and her helping us to, continue to improve. And we're just very glad to have her and as our NEC, and we thank her.
Thank you. I will do a roll call and establish who's in favor, opposed, or abstains. Mr. Durking,
Yes.
Mr. Hill,
Yes.
Mr. Maxey,
Yes.
Ms. Rooks,
Yes.
and Ms. Turner.
Yes.
I am also a yes. It is moved unanimously. We will move on to 5F, consideration of placement on provisional approval. Our first one is Cypress College Psychiatric Technician Program, Dr. McLeod, Nursing Education Consultant. Can I have a motion to approve and a second?
To approve the NEC's recommendation. This is Tara Rooks.
Thank you. Second?
Abraham Hill, I'd like to second.
Thank you. Any discussion or questions from the board? Seeing none, any public comment?
Director Jamie Ramos is in the audience. I will unmute his microphone now.
Yes, good morning. I'd like to just let you know that we're committed to bring our passing scores where they need to be, and we'll take this very seriously. And I want to thank Dr. McLeod for the guidance and the support she's given us to our program.
Thank you so much. I will do a roll call and establish who is in favor, opposed, or abstains. Mr. Durking,
Yes.
Mr. Hill,
Yes.
Mr. Maxey,
Yes.
Ms. Rooks,
Yes.
Ms. Turner.
Yes. Yes.
I am also a yes. That is carried unanimously. Our next one is Healthcare Career College Vocational Nursing Program, Ms. Della Rosa, Nursing Education Consultant. Can I have a motion to approve and a second?
This is Abraham. I'd like to make a motion to approve the NEC's recommendation.
Thank
And this
you
is
so
Kenneth
much.
Maxey. I second it.
Thank you. Any discussion or questions from the board? Seeing none, any public comment?
At this time, I do not see any. I do not see any at this time.
All right, I will do a roll call and establish who's in favor, opposed, or abstains. Mr. Durking,
Yes.
Mr. Hill,
Yes.
Mr. Maxey,
Yes.
Ms. Rooks,
Can you hear me?
yes,
Okay.
and your vote? Ms. Rooks,
Yeah.
your vote?
Yes. It was yes.
Thank you. Ms. Turner,
Yes.
thank you. And I am also a yes. That is moved unanimously. Board members, please raise your hand if you have
Dr.
any last
Melvin?
questions.
This
Yes.
is the moderator. I hate to interrupt, but I do see Catherine Silky's hand raised again. So
Okay,
I'll mute her.
Oh, hi. I'm sorry. I didn't mean to raise my hand, or it's still raised. Sorry, I didn't mean to.
Okay, thank you.
board members, please raise your hand if you have any last questions or comments or anything else for the Education Committee report. Seeing no comments, we will move on. Executive Officers Report. Ms. Yamaguchi, please provide your report.
Thank you, Madam Chair. Good morning again, everyone. It has, of course, been a very busy and interesting quarter. The most important thing to bring up for the board members, which everything is mentioned and discussed in the written report, but I wanted to highlight a few areas. One, of course, is the status of our sunset status. God bless you. As you know, from our budget presentation earlier, our sunset bill, the bill to renew the board's authority to proceed and do business, it was amended on the 16th, in other words, Monday, and we will be having that bill heard in Senate Appropriations. It'll be moved immediately to the suspense file, and I believe if the suspense file itself is not moved on the end of next week, it will be acted on the week following, then moved, of course, to the Senate floor, back to the Assembly for concurrence, and then off to the governor's office. Now, the thing about this is, of course, it's not finalized. The amendments that the amended version that we shared with you from the 16th, I know there's still discussion going on with stakeholders, with the Assembly and the Senate. So there are still likely to be some changes here and there. But all things considered, I think the major points right now is that we have been accorded some authority to charge schools to fees. It's not the structure that the board had discussed previously, and that I think is a better long-range solution. We were given, I think, some very solid both direction and I think authority to move forward with updating and refining our initial program approval process, which I think is really exciting. And I think the timelines are really ambitious. It's going to be a lot of work. It's going to be hard work for us to make sure we move forward while still being very cautious to make certain that all of the precautions, all of the quality control is still observed before a program is allowed to admit students. The language of the bill as in print right now authorizes this board to sunset on 2025, just as a kind of a context. That would mean that we would be heard again in 2024, and we would be writing our sunset report in 2023. So in other words, it doesn't give us a lot of time to work with the reforms that we've been discussing, but some, and I think it'll be an interesting 2 years that we'll have to talk about. But the other piece in the bill that I think the board will be happy to hear is that it does restore the board's authority to appoint an executive officer, although the language in the bill right now says that the person incumbent in the office on December 31st of this year should remain in the position of executive officer until either vacated or until the board elects to appoint another executive officer. Right now, that's the highlights, I think, of our sunset legislation. There were a bunch of other technical corrections and updates. But all in all, I think it's progress. I think we will be doing business again for another few years, and that I think is the bottom line good. So let me pause here in case any of the board members have any questions on that part.
Oh, this is Cheryl Turner. I think it's great news. Sunset will be extended so far ahead after been through with various sunset hearings. So congratulations on that.
Thank you very much, Ms. Turner. You're right. It is very much a good sign of the legislature's confidence in this board.
Are you going to comment on number 3 next, or?
I'm sorry?
Are you going to comment on number 3 next? The other key point about the delegation of authority?
Oh, thank you. That's correct. I'm so glad you reminded me. Yes, as the board will recall, we discussed for a number of years the board's delegation of authority to the executive officer for the default decisions, and that language was placed in this bill.
Okay, so that means we don't have to vote on that issue anymore. It's if the bill passes, then that is included. Is that right?
Yes and no, because the board will always have the ability to see all these things, and if there is, pardon me, a default decision that the board wishes to call back, they always will be able to do that.
Clarification.
But just as a footnote, though, I think the board members, well, the board members who've been on the board for a little bit of time will remember that a lot of the discussion about this issue is that of efficiency. It saves a lot of time and money on the staffing department, and also I think lessens the number of ballots in the board members' own balloting package. So we feel like this is a good efficiency move and helps keep the wheels moving swiftly. So anything else on the sunset bill? Okay. So the NCSBN annual meeting was held yesterday and Wednesday, and we on a virtual meeting, I think there were a number of technical glitches, let's say, but overall, I think that the business of the National Council was conducted very productively. There was, of course, elections. I think it's interesting to note that a lot of what's going on at the annual meeting was boiled down to the bare minimum. So we looked at, of course, the National Council's model acts and model rulemaking. The work that had been done on that level mostly pertains to advanced practice registered nurses. So there weren't any things that I think really directly would impact this board. But still very interesting because they are noticing a lot of things that need to be cleaned up and made more accountable and more fluid based on just the need to be, I think, nimbler in the wake of the pandemic. I did want to say, though, that our own crew, of course, was well represented at the annual meeting, Dr. Mountain and myself representing them. But I wanted to say a big thank you to Marie Cordero, Faye Silverman, and Cindy Fairchild, who've been serving on some advisory committees for NCSBN.
Yeah. Oh, some trash in the kitchen there.
Ken?
Yeah.
There you go. Any questions on the national meeting?
I just want to comment, Elaine, that seeing that from that perspective, it just shows you how global the NCSBN has become and how involved they are in global issues in nursing, which is, I was very surprised.
Thank you for that prompt, because I did want to double back a little bit, because the work, again, you're right, the work NCSBN has been doing on the global scale has been remarkable. And I think this is something we'll be seeing a great deal as we move forward, that trying to work as a global jurisdiction, but still maintaining our own distinctive requirements and criteria. So it's going to be interesting to see how that grows. Anything else I can answer on the annual meeting? Good deal. And at this point, then, if there's no other questions on the rest of my report, I'll hand this back over to Dr. Mountain.
Thank you so much. Item 6C is the Executive Committee report. The notes from this meeting are in the packet. Are there any questions? Seeing no questions, we'll move on.
I'm sorry.
Oh, I'm sorry. Go ahead, Ms. Turner.
Were you referring to the executive committee report?
Yes.
Okay. So I went back and tried to listen to the, again, there's a packet about the voting. Okay, you know what? I'm sorry. I'll just wait until item 11. Thank you.
Thank you. Can we move on to, I'd like to move on to item 7. We have an update from the Department of Ms. Brianna, Deputy Director.
This is the moderator. Dr. Mountain, your microphone is cutting out again.
No predicting it. All right, we'll try again. Moderator, is this better?
Yes, it is.
Welcome.
Dr. Mountain,
Yes.
we can hear you.
Hi, this is Brianna Miller. I apologize. I think I was being keyed up. Hopefully y'all can hear me okay. Can you hear me?
Yes, we can hear you.
Oh, wonderful. Okay. Well, good morning, board president and board members. I'm Brianna Miller with Board and Bureau Relations at the Department of Consumer Affairs. Thank you for allowing me the opportunity to provide a department update. One of our top priorities in Board and Bureau Relations is appointments, and I would like to provide a brief overview. Currently, your board has 3 vacancies, a public member and an LVN and psychiatric technician members. DCA and all the appointing authorities share the goal of a fully seated, diverse, and effective board. Filling current and upcoming vacancies is a priority. If any members know any great candidates, or if any members of the public are interested in serving, please find the link titled Board Member Resources on the Department of Consumer Affairs homepage, and that will direct you to links for, with which you can apply for an appointment. Moving on to remote meetings. DCA is receiving many questions about when and how boards will meet again in person and whether they can also continue to meet remotely. As the law and executive orders stand today, after September 30th, all boards and committees will be required to return to in-person meetings with publicly noticed meeting locations. However, due to ongoing changes in the COVID-19 pandemic, it very well may happen that the ability to meet remotely will be extended in some capacity. We don't have any concrete news to share today, so DCA will do all it can to assist boards and bureaus to plan safely for in-person meetings, and we will keep you informed of any changes to meeting requirements, should they occur. COVID-19 safety measures is another topic I'd like to address. To combat the spread of COVID-19 and protect vulnerable communities, California is implementing enhanced safety measures for state employees and workers in healthcare settings. State employees must show proof of vaccination, or they will be subject to regular COVID-19 testing, and they will be required to wear appropriate PPE. Board members and committee members are considered employees and must follow these health and safety protocols if they plan to be physically present in a DCA location, whether it be for a board meeting or just even a quick visit. Members must verify vaccination or follow face covering and testing protocols in accordance with that location's requirements. Statewide guidance for the use of face coverings from the California Department of Public Health remains in place unless a local jurisdiction issues a stricter public health ordinance tailored for the situation in their communities. Many counties have revised health orders requiring face masks to be worn by both vaccinated and unvaccinated individuals while indoors. And as it pertains to healthcare settings, to further protect Californians and healthcare workers, the California Department of Public Health recently issued 2 public health orders. The first order requires workers in healthcare settings to be fully vaccinated or received their second dose by September 30th. The second public health order directs hospitals, skilled nursing facilities, and immediate care facilities to verify that visitors are fully vaccinated or have tested negative for COVID-19 in the prior 72 hours before indoor visits. Licensees are encouraged to thoroughly read the CDPH public health orders and regularly check their local public health department's website for additional vaccination requirements. Questions from licensees about the healthcare worker requirements can be directed to the California Department of Public Health. And we know things are moving quickly and there is a lot of information, both official and unofficial. I encourage all members and the public to visit DCA's COVID-19 webpage for updates and resources on the state's reopening plan, public health guidance, vaccinated resources, vaccine distribution, and more. And finally, I'd like to provide a reminder about required board member trainings and the learning management system. As a reminder, 2021 is a mandatory sexual harassment prevention training year. This means that all employees and board members are required to complete the training during this year. Please also be advised that you will now access this training through the Learning Management System, or LMS for short, which is DCA's training portal. We have created profiles for each of you in the LMS and informed your executive officer of the steps you will need to take to log in and access the training. Board and Bureau Relations is also happy to assist you with any questions or concerns you may have about using LMS. Ultimately, the LMS will house your training records and may also be used to sign up for other mandatory trainings. And on that note, I'm happy to report that you can now register for the board member orientation training through LMS. As a reminder, newly appointed and reappointed board members are required to attend the board member orientation training within a year of appointment or reappointment. The final training of 2021 will be held via WebEx on October 13th. And if you have any questions about that, we're more than happy to assist. And on that note, as always, Board and Bureau Relations is here to help. And if there's anything we can do to assist you and your board, please reach out to us. That concludes my presentation, and I will hand it back over to Board President Mountain. Thank you.
Thank you so much, Ms. Miller. I appreciate that very much. I would like to tell the board members that they may take a 15-minute break, and we will reconvene at 10:28. Since everyone's returned from our break, we will move on to item 8A, the Licensing Division report, and Ms. Brown will provide the report.
Good morning, this is Shelley. The Licensing Division report is included in your packet. Does anyone have any questions? Okay, well, thank you.
Is there any public comment?
There are no hands raised in the public at this time. Thank you.
All right, we can move on to item 8B, the Licensing and Evaluations Committee report. The committee did not meet. Let's move on to item 9, is the Legislative and Regulations Committee meeting report. Mr. Durking, will you provide this report?
Yes, good morning, Madam Chair, members of the board and the public. We met as Leg-Reg Committee June 17th, just prior to the full board meeting. So many of these items have already been covered, but I'll briefly summarize. We covered AB 2138 relating to the substantial relationship and rehab criteria for VNs. Board acted on that item at the June 17th meeting, as well as the substantial relationship and rehab criteria for Psychiatric, which was the previous full board meeting. We went over the program pass rate standards for VN programs. Again, the full board acted on that matter at the June 17th meeting, and as well as for Psychiatric. Regarding the fee schedule, this has been a matter of much discussion. As the board and public might be reminded that there was a delegation to the executive committee to further consider. And we referred the matter to staff for consideration and a report. So I would ask Ms. Yamaguchi to just speak to the points of the memo that was provided dated August 16th on this point.
Thank you, Mr. Chair, Elaine Yamaguchi. Right, pardon me. The memo in the board's packet lays out the history of our recent fee increases, at least. As you know, in 2018, we had long-awaited action to increase our statutory ceiling, and then in the beginning of 2019, we increased the fees for our licensees, our applicants, and continuing education providers. We thought that at that point, that ceiling and that increase would carry over for a number of years. Unfortunately, a number of unexpected changes have called that into a little bit of a question. So at this point in time, as you know, we've also been working over the last, I don't know how many years, certainly every year that I've been executive officer, to obtain authorization to charge fees to the schools and programs. And at this point, we have not been able to obtain that authorization, although we have some language in play in our current bill. Now, as the board will also recall, almost exactly a year ago, the board did authorize the staff to initiate the regulations process to increase the applicant, licensee, and continuing ed providers fees by approximately $55 each, with a 25% fee increase on these other myriad small increases. Now, we've been working, of course, on a variety of rulemaking packages, and things move slowly, as you know. But then, as Ms. Munoz and Mr. Nishimine mentioned earlier, a lot of things have changed, not the least of which is the fact that we will be accelerating our school approval process a bit. We will need some augmentation of staff to make the changes in AB 1536 regarding program approvals. We will continue to have the augmented fees to the Attorney General's office for our disciplinary cases. Essentially, the bottom line, of course, is that the structural deficit that Mr. Nishimine and Ms. Munoz had pointed out, which we've been discussing with you throughout, is coming, I think, to a head. I think it's fair to say that we don't want to increase these fees, but our fiduciary responsibility moves that we must at this point. The recommendation in this memo is that we would increase all these fees to their statutory limit. That should bring in approximately $4 million more per year than we currently have at this point. That supports the board operations overall, and after the next 2 fiscal years, it starts building a small but prudent reserve. At this point in time, I would move to the tables also attached to the memo. It shows you what the current level of fee is and the maximum level in statute that we would be increasing these fees to with your action. Now, the one question that we hadn't resolved is that previously we had been looking to make these increases effective January 1 of 24. And as Mr. Nishimine had said, that increasing them as of January 1 of 23 would probably be a safer change to recommend. At this point, I don't know that the ensuing 15 months is enough time to move a package, but we will do our best. But at this point, it is solidly the board's call to authorize the effective date. Mr. Chair?
Thank you very much, Ms. Yamaguchi. There has been discussion regarding revenue augmentation from various fees. And as was pointed out, the board's fund, we're still projected to be unbalanced. And in point in fact, it looks like the board could become insolvent as early as January 23. You know, after review and consideration based on the direction given by the recommendation given by Ledge Reg Committee and the advice from Department of Consumer Affairs Budget Office relating to the beginning of the rulemaking process, you know, it would be prudent to implement the full extent of the provisions of SB 1480 to increase all license applicant, licensee, and CE provider fees to the full amount authorized by statute. And given the current advice, I would recommend and move an effective date of January 1st, 2024. With that said, you know, it would be expected that the increase should yield, like our EO was mentioning, the added revenue stream of up to $6 million. And so that would be my motion. Madam Chair?
Yes, is this something that we should be voting on at this meeting, Ms. Yamaguchi or Mr. Swenson?
Madam Chair, it is absolutely something that the board should be voting on. I think Mr. Deerking laid out the motion quite well. I think the question before the board, though, is whether to make the effective date of 2024 or 2023. Mr. Swenson, Mr. Tyan, any comments?
This is Ken Swenson. The action item is actually under a different item at this point. So I think that you can handle it. You can take the motion up now, but with the understanding that where it was listed is actually subpart B of this item.
Thank you, Mr. Swenson, for that clarification. Is it also your understanding that we would need to make the 4 separate motions, because since there's no regulatory language attached, just the numbers for the fee levels?
Yes, it should be taken up as 4 separate motions for each of the items listed in sub-item B, 1 through 4.
Thank you for that clarification.
So I'm a little confused about, are we asking for a motion or do we need to have the proposal set again? Because now it has to be 4 separate parts.
Yeah, so the recommended form of motion for each subpart would be as follows. I move to, and then you would insert the item. So it would be to increase the fees for application, licensure, examination for licensure, and renewal of licensure to the maximum level provided by statute. And then you use a similar form of motion for each of the sub-items under B.
Okay. Can I have a motion stating that?
Believe
send.
Madam Chair, I believe we would need to ask for public comment first.
Okay, let's open it for public comment then, please.
I'm not sure if there's a motion on the floor, so there should be a motion, call for board discussion, call for public comment on each of the sub items under B.
Yes.
Thank you,
Mr. Swenson is correct.
Then is there a motion on the sub items under B? Could we have a motion?
Yes, John Deerking here. I would so move under item B1.
Mr. Swenson, is that okay?
Yeah, so the motion pending would be to increase the fees for application for licensure, examination for licensure, and renewal of licensure relating to vocational nursing licenses to the maximum allowed by statute.
Yes, that's correct.
And do we have a second?
This is Abraham Hill. I'd like to second that motion.
Thank you. Are there any further board comments?
Yes, this is Tara Rooks. I didn't have a comment. I just had a question. My hand was raised. Can you hear me? Can the board hear? So I know that I think I heard that the committee looked at it and discovered that we hadn't had an increase in, did you say 5 years? Increase in fees in 5 years? Is that what I heard? Or 10?
Madam Chair, if I may, this is Elaine Yamaguchi. Ms. Rooks, that's correct. The most recent fee was January 1 of 2019. And so depending on the final motion, it will be either 4 or 5 years before this increase.
Okay, and we did that based, and I know that, and I really want to thank the committee for doing their homework and working hard to figure all of this out. But I was just wondering, did we do a projection? And we said that in the next 5 years, if we don't increase the fees, that we will be insolvent? Because I did hear someone mention that it's the maximum amount allowed. So I was just trying to figure out, how do we just go from what's the fee is now to maxing out, like 0 to 60? Do I make sense?
It does, Mr. Rooks, and again, I appreciate the question. We've been discussing this for a while, and when we initially put the SB 1480 fees into effect on January 1 of 2019, it was thought that that would remain a solid and predictable level, especially because we still assumed that we would have the school fees shortly thereafter for at least 5 years. Now, in 2019, of course, we were given the unpleasant news from the Attorney General's office that their fees were increasing dramatically. This is something that nobody saw coming. We had a number of other things, and we also, unfortunately, we miscalculated a little bit based on a misunderstanding about the way that the department assesses the pro rata charge. We didn't include in our initial assessment, pardon me, the percentage of revenue that goes directly to the department via the pro rata charge. So we found that we had underestimated when we initially moved out in 2019, and things that that we knew that were coming, because even back in 2018, we saw a structural imbalance headed our way without the school fees. But we had thought initially as early as 2022, then it moved to 2024, then we thought 2023, and then we thought 2025. And I apologize for kind of blathering at this point, but the on and off changes that we saw in our fiscal condition never changed the fact that we were structurally imbalanced, that we did absolutely need to adjust our revenue stream. Again, we thought that we would help that with the school fees, but at this point, the amount of school fees that we're projecting is substantially lower than really is needed, at least short term. And to address the longer term fiscal structure for our board, we must increase the applicant licensee fees and the continuing ed provider fees. So the numbers that we looked at earlier with the budget unit, it shows that I think quick change in the next couple of years is one thing. But I also did want to point out to the board, and I think this is something that we were going to discuss at great length with the execs first, and then probably at the November meeting. And that's that the one thing that the board I think really needs to do is invest in a third-party fee structure study, and to really look, I think, at our longer-term fiscal health, because there's a lot of assumptions that we're not really equipped to guess right now, not the least of which is if in the next 2 years we're able to really work out a better permanent fee structure for the schools, and if we see the rise in the number of schools that we see, and then the commensurate increase in numbers of students, and then the increase in the number of licensees, you know, that's going to play a part in that longer term. But it's impossible to you know, I think we almost need an actuary here, I think, to really, I think, get a better picture of how that moves over the next, say, 5 years or longer even. So really, to have people who are expert in that sort of fiscal projection is going to be important. It's an investment. It's going to be quite an expensive study to contract. But as I said, we've already started researching our possibilities for that. But it's not, this is not like a permanent, unfortunately. I think based on the findings of the fees, and based on what we see in the next couple of years with the structure we're asking for now, the possibilities to make adjustments, I think, are really right there. And certainly, I think we would want to do that. Is that helpful?
It is very helpful.
Good deal.
I appreciate you, and I agree with some actuary help.
Yeah.
Thank you.
This is Cheryl Turner. I have some questions. Yeah, so on that note, I was just wondering why the board would need to vote about an increase to become effective so far in the future. I think you said 2024, but I'm not quite sure. You know, why not let the board, whoever is on the board at that point, in 2022, next year, or 2023, look at it, and with the help of an actuarial report, make a decision then. So that's one question I have.
That's a great question, Ms. Turner, and I really appreciate it. There's a couple of things going on. One being that we need to project the income, and we can't do that based on the idea that in a future board we'll be asked to take this action. The second is a little bit more cynical, and that's the simple fact that it will take at least a year to move everything through the regulatory process. So that if we were looking at a fee taking effect in January 1 of 23, which is what the budget department has said would be a better, stronger approach, we're already late to the game. Although I do want to say that because the board had acted last year to start the process at that lower rate, we have already been working on the development of the documents for the package. But it is a long and arduous and very meticulous process. And then there's also the implementation of that is also extremely intricate because it needs to go into the Breeze system, which is a very slow and rife with the trouble and complications process. So truthfully, it is a long, long process, and it's just a better part. It's just the most prudent move to take action right now.
Okay. And so you find that to be true, even though we have the authority already, I think it sounded like, to raise to the maximum, whatever that number is. Feel like
No, we do. We absolutely have the statutory authority. It's the board's responsibility and the board's role to take that action to basically allow us to move from the level we're at to another level.
And from a legal perspective, Ms. Turner, if I could address that.
Yes.
The action would be to implement the statutory authority through the development of regulation. So the board has the power at this point to authorize the increase in fees for the rulemaking process, but there'd have to be an actual regulation in place to move the fee to the maximum amount allowed by statute. That's what the board decides to do, and that's what the recommendation here is. So in order to make that happen, there'd have to be a rulemaking package processed, and the regulation would have to be approved for the new fee to go into effect. And that's an arduous and time process.
Okay, thank you. I understand. All right, and then my next question is, was there already an investigation and a report made about how else we can reduce expenses before we decide to increase fees? For instance, you mentioned, or it was mentioned, that there are increased fees due to the AG's office due to the disciplinary cases. Well, that was something that the board handled. We handled the disciplinary cases, and it was my understanding it was supposed to be a temporary transfer to the AG's office so that we could catch up because we were behind. And so I'm just wondering if that would be a significant reduction right there to return those duties back to the board members. So I guess there's two questions about the investigation for reduction of expenses and about this, the increased fees for the disciplinary cases.
Thank you. Those are both really good questions. Now, the situation about streamlining operations, making efficiencies, et cetera, I think you'll recall, though, that initially when in 2018, the board staff made a lot of efficiencies, and actually that's a good deal of why we were able to push back our insolvency date a bit. But to make a change as substantial as is needed, it would take a reduction in workforce. And I think you'll recall that the problems of reducing the workforce is that we have at least steady, if not increasing, need in terms of our licensing work, our enforcement work, and our education work. To reduce the workforce means that we would probably be increasing processing times. And we've just gotten to the point where I think the enforcement staff is processing the work on a very timely basis. I think you would find in the for example, the special investigations units numbers, we've managed to make what was an enormous backlog in 2018 a very, very manageable, almost current workload right now. Now, your point about the the casework in the Attorney General's office is interesting because on the one hand, right, the board had elected to move the casework in terms of the disciplinary hearings over to the AG, and that should have caused a very small savings, but not an enormous savings. Really, the bulk of this cost has to do, ironically, with the fact that over the past 3.5 years, the staff has been addressing an enormous backlog in terms of all the casework. And by processing that backlog, things have been moving through the Division of Investigations here at DCA, as well as the Office of the Attorney General. Those costs, basically, like I said, it's a little ironic because those costs shot up because our staff was doing so much work. Now, you're right, though, that at some point that cost may come down a bit, but given the way that our payment structure, our billing structure is with both the Division of Investigations and the Attorney General's office, it's hard really to project when, because it's staggered. It's got like a 1 year or 2 year leap forward, if you will, that the bills we're paying now are based on work that was done in, say, 19 or even 2020. So it's hard really to project what that billing is going to look like in, budget year 2, budget year 3. I do hope that it's going to come down. But at this point in time, it would be less than fiscally prudent to project that. What we've projected out is based on, I think, the existing caseload. And it's possible that from year to year to year, we might be able to see some savings or project even some savings in the future. But at this point, it really wouldn't be very prudent to just say, oh, we're going to be much lower. The cost itself incrementally is so high that it's really hard to say, because the other thing is of course, and as an attorney, you probably see this all the time. It's hard to predict really how much time any one case might take. It's something could happen that entails a vast amount more work at the Attorney General's office than we had thought in the first place, or it could be something that they're like open and shut. We oftentimes are surprised by things like that. Did that help?
Well, I agree with you, but I think I'm referring to taking back the responsibility of the disciplinary hearings from the Attorney General's office and transferring that work back to the board. The board, since we have to bill 8 hours to obtain $100, I think we calculated that at about $11 and some change per hour for our work, versus what the Attorney General's office would charge by the hour, for that work. And I know it can vary, but still by now we should already have some sort of idea on average from month to month how much they're charging for that work that the board should be doing.
Yeah. May I address that? This is Ken Swenson. May I address that from a legal process perspective, please?
Okay, yes.
All right, so we're talking about two different sets of cases. The discipline cases have traditionally been handled by the Attorney General's office because of the requirement to separate the functions within the board, so that in the discipline cases, the executive officer is acting as a prosecutor. The prosecution function is separate from the board function, and the Attorney General represents the executive officer as the prosecutor in those cases. So the discipline cases have historically been handled by the Attorney General's office. The matters are heard by administrative law judges at the Office of Administrative Hearings, and proposed decisions are written and acted upon by the board through the process the board members are familiar with. That's the bulk of the enforcement work and the enforcement attorney fees. An entirely separate set of cases is generally referred to as petition hearings. Those were the cases that were formerly heard during a full day of the multi-day board meetings. Those are petitions for reinstatement of licensure, petitions for termination or modification of probation. So that's a subset of cases is they're much less in number than those that are referred to the Office of Administrative Hearings traditionally. So the board recently acted on those cases to refer those to the Office of Administrative Hearings for recommended decisions like it does for the discipline cases. The Attorney General does appear in those cases when they're heard by the administrative law judge, just like the Attorney General used to appear before the board when the board heard the cases with the assistance of an administrative law judge during a board meeting. So they're two separate processes. So the process that the board modified was simply the second part of that, the petition hearings. The actual discipline cases, that process didn't change. So if you recall, in petition hearings, the Attorney General's office would still appear at the board meetings when the board heard those cases with the assistance of an administrative law judge. An administrative law judge was there, so there's still the full day of Attorney General costs that were incurred during the board meeting. So I don't know if the staff has the numbers for that, but essentially the attorney time is very similar whether the two Attorney General or Deputy Attorneys General are present at a board meeting all day to handle the petition cases, or those matters are set for separate hearings before an administrative law judge. So that was a change, though. The change was simply for the petition cases and not for the discipline cases. And I want to make sure that we made that distinction, because if the board does take action in the future based on the reduction of the backlog, it will not be taking back the discipline cases, because those cases were never handled at board meetings. It's only the petition cases. Thank you.
Thank you, Mr. Swenson, for making that clarification. And you are right, I misspoke. I was referring to the petition cases. Somehow the board is no longer involved in a part of that process, and that's why we're meeting one day for a board meeting instead of 2 days. And so I'm not quite sure how to articulate, but there was a transfer of duties from us, and that was to help us to eliminate a backlog on those petition cases. And I'm sure that there is some cost somewhere for that. And so I'm trying to get to those numbers and the impact, and whether there would be an impact or reduction if those duties are returned back to the board. No, because that was supposed to be something that was temporary until we caught up, and was not, in my understanding, supposed to be permanent. So.
Thank you, Ms. Turner.
Okay.
Oh, I'm sorry, go ahead and finish.
No, so would there be a cost savings? So that's an example of where there could be a cost savings if we returned it back to the board. I'm not sure. I'm just trying to find out.
Actually, Ms. Turner, this is Elaine. Actually, returning the petitioner hearing process to the board members actually increases costs, because we have the costs that Mr. Swenson was just laying out that are already with the ALJ, with the deputy district attorney generals, and all the staff work. But then you add on top of that the board's time. So truthfully, when we move to have the petitioner hearings settled by strictly directly to the OAL, that was actually a cost savings, and as well as a time savings, so that we could handle the very daunting and I think very unacceptable backlog.
Okay, well, I don't want to spend any more time on this. You know, maybe we'll have in the training an opportunity to go into more details. So, you know, I've been on this board for over 4 years, and so I guess I still have some questions about the role. So I'll leave it at that so we can move forward.
Thank you, Ms. Turner. And actually, as a matter of fact, yeah, the enforcement committee will certainly be discussing this moving forward.
Are there other questions from the board? Are there public questions?
At this moment, I don't see any hands raised. I do see Tara Rooks's hand.
Apologies, I never put my hand down. I'll do it now.
Okay, I would like to do a roll call and establish who's in favor, opposed, or abstained.
Madam Chair,
Yes.
may I please
Do we
ask
need to
you to call for public comment? Could you please call for public comment? The pending motion is for item 9B1, which would be to increase the fees for application for licensure, examination for licensure, and renewal of licensure to the statutory maximum through the regulation process. And there has been discussion. It was moved by Mr. King, seconded.
Seconded by Mr. Hill.
By Mr. Hill, thank you. I see that. And then there's been board discussion. There hasn't been public discussion. So if you could call for public comment opportunity and then proceed to the roll call vote. Thank you.
Yes. Could we, are there any public comments?
I see no hands raised out in the public at this time.
All right. Public comments. I will do a roll call and establish who's in favor and who is opposed or abstains. Mr. King?
Yes.
Thank you. Mr. Hill?
Yes.
Mr. Maxey?
Yes.
Ms. Rooks?
Abstain.
Ms. Turner?
Abstain.
And I will vote yes. Mr. Maxey, we had 4 yeses and 2 abstains. Will that still pass?
This is Attorney Swenson. The motion passes by majority of those casting votes. Thank you.
Oh, thank you, Mr. Swenson. All right, then the motion is passed. 4 yeses and 2 abstains. We need to move to the next section to have another motion.
Dr. Mountain, your voice is cutting out.
Do we need to, Mr. Swenson, do we need to move to the next item to have another vote? You said we needed 4 votes.
Yes, so the recommended form of motion would be as follows. I move to increase the fees for application for providers of courses of continuing education, intravenous therapy, and blood withdrawal, and for the renewal of approval for providers of courses of continuing education, intravenous therapy, and blood withdrawal for vocational nursing to the maximum permitted by statute.
Do I have a motion?
John King would so move.
Thank you. Do we have a second?
Abraham Elwood, second.
Thank you. Is there any discussion or questions by the board? Seeing none, is there any public comment? Moderator,
not-
are there any comments?
I see no comments from the public.
Thank you. I will do a roll call and establish who is in favor, opposed, or abstains. Mr. Durking,
Yes.
Hill,
Yes.
Mr. Maxey, Ken, are you there, Mr. Maxey?
Yes.
Thank you. Brooks
Abstain.
and Ms. Turner.
Yes.
And I will also vote yes, so it is carried. 5 yeses, 1 abstention.
Madam Chair, Elaine Yamaguchi here. Point of order. I think that TB is Taisha Brown, and if we could maybe take a very, very brief technical time out to put her up as a board panelist.
Yes.
Thank you kindly. This is Taisha Brown. And I attempted to vote on the last vote and wasn't able to. And my vote was to abstain.
Thank you. Is she now a panelist so I can call on her?
Yes, she is.
Thank you so much.
Can you hear me?
Yes, we can.
Okay, great. Thank you.
Another point of order, Mr. Swenson, is it permissible to add Ms. Brown to the previous 2 votes that she was in the audience and listening and tried to vote but was not able to? Is that appropriate?
Since we moved on and we don't know at what point she voted, I don't think it's advisable. Since she apparently did hear and intended to cast a vote on this item, I think that that should stand. And my understanding is an abstention anyway. Is that right?
Point of order. Can I speak?
Yes.
Okay, I was on the call, sir, and I actually emailed Vicky to let her know I was on the call. So I greatly appreciate my vote counting.
Madam Chair, we can verify that this really was being worked on as we speak. She did email and was going back and forth with Ms. Saavedra to try and get elevated on, and so she was present for the discussion of those past 2 votes. Is it as I said, I understand, Mr. Swenson, that but I think as a courtesy to allow her to register her vote, is that possible, please?
Legally, it's permissible. However, it is a question for the parliamentarian for the board. So it would be up to, I think, at this point, to the discretion of the chair. The mechanism for that would be simply to recall the prior matters that she was available for voting on and wasn't able to, and reopen those matters to allow her to cast her vote. Thank you.
So we can, please correct me if I'm wrong, Mr. Swenson, we can recall the votes and re-vote on the last 2 proposals. Is that correct?
That's correct.
Okay. As a courtesy to Ms. Brown, I think we should do that. Mr. Swenson, honestly, I'm not sure how to do that.
You'll need a motion from the floor.
Oh, we start all over. Okay.
there'd be a motion from the floor to recall each of the matters, and then you could proceed in that manner. But that's, like I said, a question, a parliamentary question, not a legal question.
Is there a motion to recall the last two motions so that we may allow Ms. Brown to vote?
Yes, this is Tara Rooks. I move that we recall the last two motions so that Mrs.
John
Brown can
Deerking, I
vote.
would.
So it's been
Yeah,
moved.
I would second John Deerking. Yeah.
Thank you very much. It's been moved and seconded. Are there any questions?
Thank you all kindly.
Are there any comments from the public?
There are no hands raised in the public at this time.
Thank you. Then we will do a roll call and establish who's in favor, opposed, or abstains. Ms. Brown? Ms. Brown?
Yes, yes, I apologize.
No worries. Mr. Durking?
And this relates to the increase of the fees
No,
for application for VN licensure, exam for licensure, and renewal of licensure, correct?
No.
No, we're just voting on whether or not we're going to recall
No,
the
Mr.
last
Deerking,
two votes.
Madam Chair, Mr. Deerking is asking which two, and he's asking for
I beg your pardon.
which two. Or am I mistaken?
We're just voting on whether or not we're going to recall the last two votes. Do you need those reviewed, Mr. Durking?
I beg your pardon. Yeah, yes.
Thank you. Mr. Hill?
Yes.
Thank you. Mr. Maxey?
Yes.
Thank you. Ms. Rooks?
Yes.
And Ms. Turner?
Yes.
And I am also a yes. So it has been unanimously voted that we will re-vote on the last two proposals. So, Mr. Swenson, can you help us with those proposals again?
Certainly. So the first in order would be item 9B1. The motion was to increase the fees for application for licensure, examination for licensure, and renewal of licensure to the maximum permitted by statute. It was moved by Mr. Deerking and seconded by Mr. Hill. The board discussed it and took public, they had to provide an opportunity for public comment. So it can be recalled this time. Thank you.
That means we can re-vote at this time, yes?
That's correct.
Thank you so much. All right, I would like roll call vote. Ms. Brown?
Trying to unmute. Thank you, everyone. Yes.
Thank you. Mr. Durking?
Yes.
Thank you. Mr. Hill?
Yes.
Mr. Maxey?
Yes.
Brooks?
Abstain.
Thank you. Ms. Turner?
Abstain.
And I am a yes. So the vote is now 5 yes and 2 abstains. It is carried. Mr. Swenson, can you please review the second vote that we are redoing?
So the board will be re-voting on item 9B2. The motion was to increase the fees for application for providers of courses of continuing education, intravenous therapy, and blood withdrawal, and for renewal of approval for providers of courses of continuing education, intravenous therapy, and blood withdrawal to the maximum level permitted by statute. It was made, the motion was made by Mr. Deerking seconded by Mr. Hill. The board discussed it and provided the opportunity for public comment. With the motion to recall it is ready for recall this time. Thank you.
I will do a roll call and establish who's in favor, opposed, or abstained. Ms. Brown.
Opposed.
Mr. Durking.
Yes.
Mr. Hill.
Yes.
Mr. Maxey, yes.
Ms. Rooks.
No, I mean abstain. I'm sorry, abstain.
No worries. Turner.
Yes.
And I am also a yes. It is 5 yeses, 1 no, and 1 abstain. Can we please move on to 9B3? Mr. Swenson, could you help us with this?
Thank you, Madam Chair. The recommended form of motion would be as follows: to increase the fees for application for licensure, examination for licensure, and renewal of licensure for pharmacy technicians to the maximum level permitted by statute.
That's psychiatric technicians, sir.
I'm sorry, I may have misspoke. It relates to psychiatric technicians.
Do we have a motion?
John Deerking would so move.
Thank you. Is there a second? Is there a second?
Mr. Hill, I'd second that.
Thank you. It's been moved and seconded. Is there any discussion or questions by the board? Hearing none, I would like to ask, is there any public comment?
There are no public comments at this time.
Thank you. I will do a roll call and establish who's in favor, opposed, or abstains. Ms. Brown.
Abstain.
Mr. Durking.
Yes.
Bill.
Yes.
Mr. Maxey.
Yes.
Brooks.
Abstain.
Turner.
Abstain.
And I will vote yes. It is carried 4 yeses to 3 abstains. Mr. Swenson, will you please help us with 9B4?
Thank you, Madam Chair. This motion would relate to psychiatric technicians. The recommended form of motion would be as follows: to increase the fees for application for providers of courses of continuing education, intravenous therapy, and blood withdrawal, and for renewal of approval or providers of continuing education, intravenous therapy, and blood withdrawal to the maximum level permitted by statute.
Thank you. Do I have a motion?
John Deerking would so move.
Thank you. Is there a second?
Mr. Hill, I'll second.
Thank you. Are there any comment or discussions by the board?
This is Tara Rex. I do have a question. Is there any way to amend the motion? I know it's probably too late because we've gone through 3, but I think my struggle is that even though the committee laid out very good reasons for the fee increase, and then Ms. Yamaguchi explained so eloquently about why it's happening, I still think that I don't have enough information to just say, yes, let's just go the max. And I think that's my struggle, if I can share that with the board. So is there a way to revisit? I know that we've been working on this for a long time, and this has been in conversation for a long time, but there's also very new board members that are here that don't really know the history like some people. Is it too late to try to amend it, or like Turner mentioned?
Kenneth, I'd like just to mention the board has voted and taken action on the other items.
Yeah, not the other ones. I know that it's too late for the others.
And the prior items would no longer be germane.
Okay.
And it's not germane to this pending item. Thank you.
Got it. Thank you.
Are there other comments or questions by the board?
This is Taisha Brown. My concern would be that we're already in a situation where we've hindered a lot of these organizations from getting their license. And as we know, the Black community, Brown community has been disenfranchised tremendously. Organizations that are really trying to get into this field. And I think the fees being higher is going to only put them further behind. So I just wanted that to be put on the record.
Thank you. Any other comments? Are there comments from the public?
I see no comments in the public.
Thank you. Ms. Brown?
Abstain.
You? Mr. Durking?
Yes.
Mr. Hill is yes.
Mr. Maxey?
Yes.
Ms. Rook?
Abstain.
Ms. Turner?
Abstain.
And I will vote yes. It is carried 4 yeses and 3 abstain.
Madam Chair, Ken Swenson here. If possible, could you recall or revisit item 9A2? If you recall, we went from the discussion regarding the fee schedule at item A1E into item 9B. And so if you could just revisit item A2 relating to AB 1536 to revisit that and provide an opportunity for any public comment. Thank you.
Public comment on Moderator, do you see any public comment?
Dr. Mountain, I do not. I was giving them 60 seconds to see if somebody raised their hand. But at this moment, I do not see anybody. There are no public comments.
Thank you. From the list, are there
Dr. Mountain, your mic is, you're cutting in and out.
Are there other questions? The board members have other questions or comments on the regulation? Is this part of our discussion on the reg concluded, Mr. Durking? Moderator, can you hear me?
Yes, ma'am, I can.
Thank you. Right. Once again, have we concluded the reg portion of this meeting? Are there any further questions?
Dr. Mountain, you keep cutting it. You're cutting in and out again.
I wonder if it has to do with the way the internet is. Are there any questions or comments on the report? To item 10, division.
Dr. Mountain, it's cutting in and out again. It may have to do with your internet connection.
Is there any, are we ready to division report?
I'm sorry, I didn't hear that.
Are we ready to move on to the enforcement division report? Ms. Wood, will you please provide this report?
Madam Chair, Ken Swenson once again. I think you're asking whether there was any further discussion of the committee report, but we have not covered item 9C relating to the substantial relationship and rehabilitation criteria for vocational nursing and psychiatric technician licensure.
Can we please address 9C at this time? Ms. Yamaguchi?
Thank you, Madam Chair, and Mr. Deerking, with your permission. 9C 1 through 4 were acted on through previous board meetings. C1 was our June 17th meeting. C2 was at our November 2020 meeting. C3 was at our June 17 meeting, and C4 was at our November 2020 meeting. So there's no action required at this time. Thank you.
Thank you. Is there further comment from the board members regarding the legislative committee report? Seeing no hands, is there any public comment?
There are no public comments at this time.
Thank you. And we move on to item 10A, which is the Enforcement Division report. Ms. Wood, will you please provide this report? Ms. Wood?
Hi, this is
Antoinette, you are unmuted.
Thank you. This is Antoinette Wood, Enforcement Division Chief. You have your report in the packet. I just want to highlight a few things. Case aging is down, even with the court delays due to COVID. We have streamlined processes and adopted efficiencies that have led to this. Does anyone have any questions?
Thank you, Ms. Wood. I see no questions. Is there any public comment at this time?
There are none.
Thank you. I'd like to move on to item 10B, the Enforcement Committee report. Mr. Maxey, will you please provide this report?
Yes, I will. Thank you, Madam Chair. Let me first begin by saying Ms. Wood and her team have done a fantastic job. We've had 2 committee meetings since May's board meeting, and we've been working towards accomplishing several enforcement goals. One, the enforcement dashboard. Ms. Wood is developing a dashboard for the enforcement division at the request of the committee, of course. The dashboard will track what types of criminal charges or licenses are being arrested for, complaints by region, and petitioner hearing information. The committee is really excited about this because of the possible uses for this data as we look to new ways to predict and respond to enforcement issues. Our hope is that with this data and with education and outreach, the board can reduce the number of licenses involved in the disciplinary processes. Next, Memorandum of Understanding. The committee has approved the Enforcement Division request to pursue a memoranda of understanding to permit sharing documents with the California Department of Corrections and Rehabilitation and state hospitals. The goal of the MOUs is to reduce the case aging by reducing the wait time the documents requested for these departments. Number 3, mental health. The committee requested that the Enforcement Division review how to support the mental health of board licensees in light of the COVID-19 pandemic. It was suggested that we produced a public PSA, much like the one that the California State Athletic Commission produced. Vicki, can you please play that PSA so the board can review the concept and consider moving forward with that?
Yes, Mr. Maxey, there will be a 60-second delay as I am passing over presentation.
Thank you very much.
Sarah, are you available? Working?
Yes, one moment while I get the YouTube video up and running. It's giving me a little trouble.
Thank you.
All right, one moment. It's not giving me the usual option to optimize for video, so please let me know if you don't hear any audio when I click play on the video.
Sarah, we have no audio. Sarah, are we able to use the closed caption feature?
Very good.
Shall we restart it?
In the interest of time, I would probably say no.
This is Sarah. Was it not playing the audio?
No, it was
No,
not.
it surely was not.
Darn. Let me see. Stop sharing real quick. I apologize. Typically, WebEx gives me an option to optimize for video. However, it's not giving that option right now. If you'd like, I can restart the video and just have closed captions on.
I mean, so, Madam Chair, what is your feeling?
I would open it up to the board members if they would like to do it that way. I wonder if we could load the link so that we could watch it with the sound at another time. Is there a way to share the link?
Madam Chair, we can absolutely upload the link to or email it rather to the board members. But you know, it's the pleasure of the board to rerun it with the closed captioning. I mean, it's a couple of minutes.
Sure. Okay.
Sure, go ahead.
All right, in that case, let me go ahead and start the video and I'll keep the closed captioning on. It is a little hard for me to hear any audio cues as the video's audio is going at the same time, but I will try to make sure I'm keeping an eye out if anyone has any questions. So I will go ahead and restart that video.
Thank you. So that is a video that we would like to use as an example for the mental health PSA. So more to come on that. Next, I would like to talk about the equity training. The committee requested that the Enforcement Division provide staff with equity training. The division scheduled an unconscious bias training for October 2021. I'm not sure of the specific date, but that is when that unconscious bias will be taking place. So really excited about Ms. Wood and her team making that happen. Petitioner hearings update. The committee is studying the effect of referring petitions for reinstatement or for the modification or earlier termination of probation for hearing and proposed decisions by an administrative law judge. As the members will recall, the board voted to refer petitioner hearings to the Office of the Administrator Hearings at the February 2021 meeting. The board took this action to reduce the backlog of petitions due to the limited number of hearing slots regular board meetings. At the time of this board action, petitioners were being set for hearings before the board 2 years out. I am pleased to report that as a result of the referring the petitions to OAH, my apologies, the backlog of petitions have been eliminated. To put this accomplishment into perspective, I note that if the petitions had not been referred to OAH, approximately 50 petitions would still be waiting to be heard. That means some 50 petitions for reinstatement or for the modification or early termination of probation have been heard that would not have been heard if the board had not taken action. So kudos to the board. In human terms, the action of the board to refer the petitions to OAH for hearing means that 50 people have had their matters heard who would not have otherwise had. Having the petitions heard quite literally has allowed these petitioners to obtain results and move on with their lives and their lives. At the same time, I note that the board has retained full authority to decide the petitions referred to OAH for hearings. The process is the same for the discipline cases. An administrative law judge hears the petition and makes a proposed decision. The board has retained the power and the authority to accept or reject the proposed decisions of the administrative law judge, just like in the disciplinary case, and may, if necessary, hold a recommended decision for deliberation in closed session. To date, the board has adopted all of the proposed decisions through the main balloting process and has not had to hold any for discussion in closed session, indicating that the majority of the board members agree with the factual findings and the conclusions of law made by administrative law judges in each of these cases. The committee plans to continue to study these trends and to develop further recommendations for handling petitioner hearings once sufficient data has been obtained, analyzed with the goal of preventing the development of backlog in the future. Madam Chair, that concludes my report. And once again, I just want to commend Ms. Wood and her team on a job well done.
And thank you so much for that report. I agree. I want to commend them. I'm very excited about the dashboard. I hope that along with the dashboard will be a YouTube video on how the dashboard works that could be shared with students in the LVN program so that they are prepared as they move forward. I also really appreciate that video. It was very moving, and I look forward to hearing it with sound. Are there other comments from the board?
Yes, this is Cheryl Turner. Okay, so I guess this is what I was referring to, the OHA. So congratulations on catching up and eliminating the backlog. And so the purpose to send it to OHA was to eliminate the backlog. So now that the backlog has been eliminated, I'm just wondering when can we consider returning those responsibilities back to the board? Because the board, you know, if we, as I keep saying, if we continue to delegate every responsibility that we have out to everyone else, as you can see, our board meetings are getting shorter and shorter. Maybe folks like that, you know, some people are happy. I know I signed up to be a part of this board because, you know, I wanted to be involved and try to make a difference. I'm not perfect in every way, but, you know, I think I have good intentions. And so, yeah, I'd like to know when we might have those responsibilities back again. And I know that there are times that I have personally not always agreed with the recommendations but I'm sure that there's been a majority that has, voted to go with the decision. So yeah, when can we have our duties back on that? That's what I'd like to know.
This is Mr. Maxey. I hear the board member. I think that it's something that we could consider as a conversation piece within our committee, but happy to entertain Madam Chair or staff to go into it today, or we can talk about it at a future enforcement meeting. And I welcome any of the board members to come and speak.
Ms. Yamaguchi, I'm going to defer to you on this.
Thank you, Madam Chair. And I, in turn, I'm going to defer to Ms. Wood.
Hi, everyone. This is Antoinette Wood, the Enforcement Chief. So since we had a motion at the board to send this back to the committee for review and analysis, I believe we would be best served by taking it back to our committee. We do have a committee meeting coming up in October where we're going to review the data. As Mr. Maxey stated, any of the board members are free to attend. I can have Ms. Saavedra send everything out with the video and the dashboard so that it's all in one email.
Thank you very much. That's excellent.
Thank you.
Are there any other comments from the board? Are there any public comments?
I do see Miss Catherine Silky's hand raised. I will unmute her now. Miss Silky, your hand is raised. Your microphone is unmuted.
Okay, I as much as I really think the concept of a PSA is terrific, I'm struggling with the having a boxing scenario as the main focus, because to be blunt, it is a blood sport. It's a sport that causes deaths and lots of injuries and head injuries to the people who participate. I would just rather that we not use that particular sports scenario for this type of a PSA. That's my comment. And if you could take my hand down, I'd appreciate it, because I don't have that on my screen anymore to do that. Thank you.
Thank you for your comments.
Madam Chair, if I could respond, if you don't mind. Sure. Dr. Silky, we used that because it was an example we had from another board. An example we would use, a case we would use would not involve boxing. It would involve the psych techs and the vocational nurses and the work and the pressures and the mental health issues that they're countering. It certainly wouldn't relate to boxing.
Thank you for that clarification, Ms. Yamaguchi. And that was a great comment. Any further public comments?
There are none.
Thank you. Discussion on the process and procedures of board member ballot voting. Ms. Woods and
Dr. Mountain, we can't hear you. It's very faint.
Move on to item 11, discussion on the process and procedures of board member voting, ballot voting, Ms. Wood and Mr. Prouty. Were you able to hear that, Ms. Saavedra?
It was very faint, but I can hear you better now.
So we are moving on to the discussion on the process and procedures of board member ballot voting, Ms. Wood and Mr. Prouty.
Thank you for this. You do have the memorandum from Elaine on this. Does anyone have any questions?
This is Ms. Turner. You know I'm going to have some comments that I had brought up in the executive committee meeting about it. So I don't know if it's a good time to revisit them for the entire board now, or if there's some other issues that you wanted to mention. All right, so at the executive committee meeting, I am not a member of that committee, but since part of my alleged voting record was presented at that meeting, I thought it was important for me to address some of the issues that I was having regarding voting. And so at that meeting, which I tried to replay what was said, and all I heard is from my comments is that it looks to me like this voting record is inaccurate, which I still contend. It has been updated with some additional votes, but it still does not reflect all the voting that I and the board engaged in. So I had started by saying that this voting record relates to vote by mail ballots and petitions for voting, reconsideration that are sent to the board to their emails. And I called it homework. It has nothing to do with voting in person at board meetings or at any committee meetings, but these are cases that are sent to the emails of board members, and they're supposed to act on this on their own time, at home or work or wherever they have the free time to do it. And so I had listed part of my concern was that at least I was having some internet email communication problems, that we used to have access to a DCA email account where we would receive communications related to the board. And sometime during the pandemic, or something happened which caused our access to be limited, as the staff member then started using personal emails or business emails to send these ballots. And I had mentioned that these ballots are being sent to my business email account, which is very full of business issues related to my practice. Okay, so sifting through has been an issue. And I also mentioned the difficulty I had trying to reconnect to the DCA internet system. I was questioned about why I didn't reach out for help to correct this, and I did mention that I had contacted the webmaster and that we had no success with that. So these continued to be sent by one staff member to my business email account. Okay, the second thing I mentioned was the method of identifying mail ballots. When they are called for, when they are due, they're referred to by the due date. They're not referred to by the date printed on the ballot. And my contention is that if the ballot says May 23rd, it's a May 23rd ballot. It doesn't become a June 3rd ballot because it's due on June 3rd or whenever it is that the staff member calls for it, which creates confusion. Because if someone says, where's your June 3rd ballot? You're looking for a June 3rd ballot that doesn't exist. It's a May 3rd, 23rd ballot. I also mentioned access to the cloud. These, the email that is sent, it has a link in which you would click on that to access case information, your homework in the cloud. After a certain period of time, access is denied. And I had mentioned that I understand the importance of it, that protection of security after a certain period of time, it is secure information, it is personal information to some of the licensees that are being evaluated. So you would not want to have it open too long. However, it creates a problem if someone, a staff member, asks or inquires whether or not you addressed a particular case, you may have a very extremely difficult time determining whether or not you did address that case because you no longer have access to the case through the cloud because that link, it no longer works. So verification makes it very difficult. Also, I noted some inaccuracies in this voting history. And I saw before this one up to 10 vote by mails, ballots, and petitions for reconsideration that the board voted on that was not included. Since that our meeting with the executive committee, 3 ballots were added, but still we are short 7 ballots. January 6th, the 13th, the 24th, March 24th, April 7th, May 7th, June 10th. And so I'm very concerned that if, you know, a record like this is going to be published to the public, that it be accurate, that it accurately reflect board members' votes. And it's my position that it does not, because it leaves out a significant number of votes. Thank you.
This is Antoinette. Does anyone else have any comments or questions?
Seeing no further comments from the board,
There are no public comments at this time.
all right, thank you very much, Ms. Wood, for that report. We will move on to 13.
Dr. Mountain, you're cutting out again.
Item 13, suggestions for agenda items. Oh, I'm sorry, I missed public comment on items not on the agenda, item 12. Are there any public comments on items not on the agenda?
I see no hands being raised and out in the public.
Thank you so much. Item 13, suggestions for future agenda items. Board members, please raise your hand if you have a suggestion for a future agenda item. I see no hands raised. Are there any public comments?
There are no public comments at this time.
Thank you so much. We will move to item number 14, meeting adjournment. The meeting is adjourned at 12:05 p.m. Thank you to all the board members and all the people who are in the audience and all the support people and everyone at the BVMPT.